Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle in studio. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject you have in mind. Perhaps you've had a problem, you've tried, you've applied, but you've come up with the same old, whole lot of nothing that works. Well, here's an opportunity for you to turn that around. We can put the fix to it, if you will, and give you something that you can actually use that will quell the problem. We have a topic for you today, and I have a guest in studio, a topic that affects, unfortunately, 50 million Americans. And what's that? That's chronic pain. According to the American Pain Foundation, 50 million Americans, which is a huge part of the population, 1 in 3 Americans, if you will, lose about 20 hours of sleep each month due to pain. That's not a really good thing. From headaches to back pain to just pain all over. I hurt everywhere that can possibly hurt. Tagging it whether it's arthritis or fibromyalgia, chronic, whatever. We're going to talk about those things in depth. We're going to talk about the pathways, and we're going to talk a little bit about how to fix that. But to do that with me in studio, someone who is very familiar with Dr. Tom Roselle Live and a guest we've had many times, Dr. Leonard Poe. Good afternoon.
Good afternoon.
Welcome.
Thank you.
We want to take a second to welcome a new affiliate that's tied into Dr. Tom Roselle. Out of Richmond, Virginia, we have WLEE 990 AM. Welcome. We're here every Sunday bringing you the most informative and very specific information on integrative care, from nutrition, acupuncture, chiropractic, homeopathy, anything that you'd like to know about. This is an opportunity for you to really get the answers put to it. But today we're going to talk about pain. And we'd also like to let you know that this Wednesday evening, the 20th of the month, Dr. Leonard Poe will be your presenter, your host at the Roselle Center for Healing, and he's going to be talking about chronic pain and pain management, what you can do to break the cycle, if you will. So if you'd like to join us, you'd like to join Dr. Poe this Wednesday evening, all you need to do is call the Roselle Center for Healing in Fairfax, Virginia, at 703-698-7117, 703-698-7117. And for those of you who are way outside the area, you're way down south in Culpeper and down near the beaches or down in Richmond and so forth, you can go to drtomroselle.com. It's DRTOMROSELLE. That's DRTOMROSELLE. And there's a section in there that you're going to see all of our in-house programs. This one won't be posted for some time, but there are many others that are there, and we'd love to have you go through those. They're inexpensive to rent, and you can see topics from allergy reactions to pain patterns, to irritable bowel, to you name it. We've put it out there, hip and ankle pain, and so forth and so on. So take a tour, drtomroselle.com, and have some fun and get educated. And remember, health is a do-it-yourself program. You are in control. This is not something that you need to leave to somebody else. This is important that you take control of your own health. Dr. Poe, let's talk a little bit about pain, because there's so many people that suffer from pain and are debilitated from it. They've lost income, their families suffer, their social interactions go amiss and so forth. But it's something that I know that you see on a day-to-day basis. Truly, when you look at pain, there is a why is that. And unfortunately, from the allopathic community, they treat the symptom process, meaning medications.
Right. And that's the biggest problem, really. And it's probably the worst thing you can do, because it's a hard thing to say, but sometimes pain is a good thing because it lets you know that something's wrong. Of course, we don't want people to be in pain all the time. We have a quality of life issue there, but you've got to get down to the root cause of, well, why do you have the pain, instead of just trying to manage the symptomatology of it.
It's unfortunate. With pain patterns, we have the physical pain, the physiology of it, but the interrelationships, the social interactions, the family, the self-esteem issues, the inability to do things. I can't lift anything anymore if I walk any kind of distance.
Yeah, the quality of life, it goes away.
It does. It totally dissipates.
The worst thing is when you see patients like that where they think, this is just how it is. This is normal now.
Yeah, or what do you expect for your age?
Yeah, it's terrible. Or you're going to die anyway.
Yeah. Sooner or later, we're all going to leave the practice, of life. But the bottom line is that there is a quality that we need to maintain over the years.
And you can maintain.
And you can maintain, and that's it. In your opinion, is there any singular cause of this chronic pain pattern, or give us a kind of a look at the spectrum of what's there?
No, no, there's not any kind of singular cause, and I think that's where we really go amiss in trying to treat this thing. There's lots of different reasons why people have pain. We can take it back to the triad of health that we talk about a lot. There's structural reasons why we have pain. There's biochemical reasons that we have pain. There's emotional. But there's many different reasons why. If you've got a joint that's out of place and it's causing pain because it's irritating the receptors in that joint, well, you've got to put the joint back in place. You can't just keep covering it up with aspirin. If it's biochemical pain, well, what kind of pain is it? Is it inflammatory pain? Is it non-inflammatory pain? Those things make a difference, especially when we come to treatment. You've got to treat it the right way. It's like putting a round peg in a square hole. It doesn't always fit. And so you've got to figure out, well, what's the true reason behind it? And if you fix that, well, then you get rid of the pain at the same time, and then you don't have to continually manage it the rest of your life.
So the whole idea is to ask the question as far upstream as you possibly can get it.
Why?
What's
why
going
do you have
on?
the pain? Yeah, absolutely.
And unfortunately, headaches and body pain are not aspirin deficiencies.
No.
But that's how we treat things. Put out the inflammation without asking where's the inflammation coming from. Put out the pain without knowing why the nerves are screaming.
Right.
And what's taking place. So
over time, it makes it worse.
That's the problem.
That's the problem.
It's ignoring it.
That's it drives. I know it drives you nuts. It's the same thing when we hear patients that get nerve blocks and they get cortisone shots and things like that. It's going to make it worse because you're hiding the pain and then you're still working the joint. And you're going to grind the joint. You're going to make things worse over time.
888-630-9625. That's 888-630-9625. Love to take your calls on any subject. We're talking about pain, but nevertheless, this is your microphone, your stance. We will do whatever we can to make things a whole lot easier for you. This is an opportunity to really get deep in, Dr. Poe, with how the pain mechanism comes about. Because, for example, let's take a patient who has headache pain. They come in and they said, my head is killing me. And I always get these headaches, and sometimes they only get them at certain times of the day. Sometimes they get them with food. Sometimes they just show up. Sometimes they wake up with them in the morning. But traditionally, they're treated all the same way in the allopathic community, but they can be differentiated.
Right.
And that's important too. The time frames, the quality of pain, the type of pain, the triggering mechanisms, how long they've had them, the exposures, they can be differentiated.
Yeah, you just have to be a bit of an investigator. You've got to ask the question. You got to do a good history. You maybe do some blood work. I mean, simple things, but you just got to kind of dig at it, and you can figure out, okay, what's the commonality here? Where's the pain coming from? Then you can get to those points.
So let's talk about, something just for fun. Say a guy comes in and he says, I've got pain in my shoulder, radiating up into the head, just behind the base of my skull, radiating into my eyes. And it happens, after dinner time, most every night. I'm done with my day, and boom, it's there. How do we begin to investigate that? I mean, that's a typical pattern, and the reason I brought that up is because we see a lot of that type of presentation.
Yeah. Well, it's... First, one of the first things you're bringing out there is the shoulder pain, the radiating shoulder pain. And we think about that, we're thinking, a lot of times that correlates with referred pain from organ systems, specifically liver, gallbladder. And if you look those things up, you can kind of see where some of those patterns are. But liver, gallbladder, and then when we look at the acupuncture system, we look at the meridian system in that kind of instance, those meridians run right up along that area. They run back along the back of the skull, all the way to the front, towards the eye. They kind of do a little zigzag, and then they end up right behind the eye. And getting that kind of headache after dinner is the next kind of clue. Well, maybe this is a problem with gallbladder. Maybe it's a digestive problem. Maybe either you've got gallstones or it's not working well, or you're eating things that you shouldn't be eating. And that's when we have to start asking more questions. So that's how you start tearing apart the pattern of it, and you start pulling in all these different things we know about the why, and you can get to it.
So here's a structural type of pain, something that's obviously affecting one part of the body, but that's not where the trigger is. The trigger is in an internal environmental
down. Yeah,
it's an organ system relationship.
If it is a gallbladder problem, then you got to fix the gallbladder. And but what needs to be fixed about it? You still have to dig that deeper question. Is it because you've got gallstones? Is it because the bile's thick? Is it because the energetics for it just aren't where they should be? That's where you still have to ask the question. Well, great, it's a gallbladder, but why? What's the problem with it? Is it something you shouldn't be eating? And so you have to keep digging. And you can get to that point. You just got to keep digging until you find it.
Keep asking the question and do the examination properly, and not just a 2-second consultation.
Here's some aspirin. We'll see you.
Take that. See you later. 888-630-9625. This Wednesday evening, the 20th of March, Dr. Leonard Poe will be your host, your presenter at the Roselle Center for Healing in Fairfax, Virginia. Love to have you as our guest. All you need to do is call us at 703-698-7117. That's 703-698-7117. These presentations, these in-house continuing education lectures are our gift to you, and we encourage you to take advantage of them. Learn as much as you can about how to take care of your own health. We do require one thing. It's called a reservation, because once we're full, and then we don't have any place to put you. So give our office a call, and we'd be more than happy to have you as our guest. Let's go to the phones. Fred, thank you for calling from Centerville, Virginia. What's happening, my friend?
Doctor, constantly listen to you. Just love the show. It's too bad you're not on for more hours.
Hey, talk to the station and tell them. I have sent them emails. Great, and, keep doing it.
Anyway, just as an aside, I do get headaches after eating, and I have for years, for 30 years, and nobody seems to be able to get to the problem. But the reason I'm calling is, about 6 weeks ago, I started to have severe headaches. It seemed like I'm guessing, but like tension headaches, but at the same time I was dizzy or lightheaded, especially when getting up out of bed or laying down in the bed. And it went on for about 5 weeks, and then the beginning of this week I started to feel nauseous all the time. So I wound up going to the ER Friday afternoon. They did a CAT scan, which was clear, a chest x-ray, which was clear, some blood work, or a lot of blood work, which was within normal limits, and a urinalysis, which was fine. And they sent me home with Norco and Fiorate or something that's for the pain.
Yeah, sure.
Now, the thing that scared me and sent me to the ER was that my younger brother died a year ago from what they called an aggressive brain cancer. And
so they ruled that out.
And so it seems that they've ruled that out, but that was my big scare. The other thing is I've had peripheral neuropathy for about a year, and the doctors at the VA gave me some endo something or other that did absolutely nothing and just made my stools tarry, so I discontinued that.
Well, let's take it. We've got about a minute and 10 seconds. So let me answer a couple of quick things for you. And obviously, if we can talk to you off the air as well. But here's what's going on in a couple of different things. And Dr. Pope, feel free. The problem that you're experiencing, the fact that you're having the dizziness and the weakness going from a laying down position to standing up, that's your fight-flight system. That's your adrenal glands. Your adrenal glands put out hormones that allow your blood to stay stable when you change postural positions. If that doesn't happen, it drops down and you get dizzy. That adrenal system, that fight-flight system, can trigger headaches and other body pain because they also produce hormones that put out inflammation. So if the inflammatory levels get high, then you have a problem. That can be dietary, that can be biochemical stress. The fact that you get headaches after you eat has to do with digestive function. That can be your liver, that can be your gallbladder. So any of those things, Fred, can be the problem. Those are easily gotten rid of. We just have to find out why it takes place. Fred, I'm sorry, we've got to stop for a break. Thank you for calling. You can get a hold of us at the Roselle Center for Healing or go to drtomroselle.com. Stay tuned. We'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject you have in mind. Guess what we're talking about? Pain management. And that's going to be the topic of our in-house continuing education program at the Roselle Center for Healing in Fairfax this Wednesday, the 20th of March, 7:30 p.m. Give us a call at 703-698-7117. 703-698-7117. Make your reservations because that's what we require. It's no cost to you, but we do require a reservation. Love to have you. And if you'd like to talk to us today, again, 888-630-9625. Want to encourage you, go to drtomroselle.com. Go to drtomroselle.com. Take a tour, look around. If you don't have a copy of my book, which is a manual on how to control your health, your life, it's an opportunity. Get a hold of it. Ageless Health. Health is a do-it-yourself program. It's something all of you should own. It's one that puts a step-by-step, sane approach to getting and retrieving your health. Not to own it is not being proactive, so make sure that you get that done. But you'll find our in-house continuing education programs. They're all there. They're very inexpensive to rent. You can sit and watch them for a day or three and get educated on any topic, whether it's allergy or pain patterns or irritable bowel syndrome or hip and ankle pain, and it goes on. There are many things, just nutritional protocols as well. That's set up for you. We did that for you. Take advantage of it. 888-630-9625. That's how you reach us today, and that's how you ask Dr. Poe questions on pain. He will be your presenter this Wednesday evening. Call us and make a reservation. Dr. Poe, we have a few minutes. Let's talk about pain again. We know that it's embraces structural, chemical, emotional, but a patient comes in and they say, I hurt all over, doc. I mean, there's not a day that goes by that my body hurts. How do you begin the process? I mean, here's nothing that they can put their finger on and say it hurts right here. They say I hurt all over. How do you begin to at least differentiate the type of pain patterns?
Well, first of all, you would start off with, what kind of, I would at least, what kind of pain is it? Is it a burning pain? Is it a pulsating pain? Is it, kind of give me an idea of what kind of pain it is. How long has it been there? But then you got to go through and you got to dig in through all that history of, where have you lived? Where have you grown up? What have you been around? It can be, and that's where you can start to come to, what truly kind of pain is it? And then other things are helpful too. If they've got past blood work, look at some of those things. But you've got to look at the whole picture.
So
the other thing with that too is that because sometimes we'll get stuck. And the last caller was kind of an interesting question because, he's bringing up two different reasons probably why he has pain. And so can there be multiple reasons?
There are always multiple things.
Absolutely.
I mean, from our perspective, when we look at the things, we know that the why is sometimes you have to ask the questions, you have to dig, you have to do the right things to get there.
Right.
And not just say, you got pain, take this. So
there can be many different reasons as to why.
So you have a patient that has pain all over, and at this point, I mean, you have to ask them a series of questions differentiating whether certain motions cause the pain, or if they eat certain things, does that trigger the problem? Is it there all the time? Do they ever feel really good? Have they had multiple exposures? Where have they lived in their life? Because so much of this stuff is accumulative, and then it's like the straw that breaks the camel's back.
Yeah.
And you end up with tremendous amount of some kind of discomfort. Interesting situation that I came across the other day. I had a patient that came in, and they had leg pain, and it never occurred. I mean, it was down in their foot, it was numbness and so forth. They had full range of motion, but the only thing that made sense is they had a surgical scar over the top of their inguinal area. They had a couple nodes removed, and that was it. So how can that relate to anything?
Well, it can relate in a lot of different ways. I mean, you can have, if you had some lymph nodes removed, you can be getting poor lymphatic drainage from that spot. And it can be down at the foot because that's where most of it's going to pull just because of gravity. So you've got different kinds of inflammatory chemicals called chemokines that can be building up in that area. You can have damage to the nerves from the inguinal area. It can be radiculating pain. And it can be lots of different things.
You know, one of the things I found with this gentleman was very interesting. He had one of those things that you were talking about, but also in addition to that, the acupuncture meridian for the kidney, and it didn't clue to me until he told me that when he goes to the bathroom and urinates, he gets back pain on the same side. And I said, really? So then we checked the acupuncture pulse to the kidney meridian, which starts on the foot and comes all the way up and ends on the chest. And the surgical scar was directly over that kidney meridian. And all we did was break up some of the adhesion around the surgical scar, and it went away completely. And so when you're looking at things, you have to look at all the pieces of the puzzle.
Yeah.
You know, we have several phone calls from our listeners coming in, and we're going to take them. We have about 30 seconds before a break, so don't go away. Stay there, and we promise we'll get to you. But, Dr. Poe, one more quick question. When you're dealing with somebody like this, knowing that it's an acupuncture problem, real quickly, with acupuncture, the energetics are something that you have to look at, but diet can affect those energy pathways.
Absolutely, yeah.
So when you look at those things, you've got to kind of interweave them and put them together. But here's the thing, as Dr. Poe's been laying out for you, it's about digging as deep as you can to find out what the pain patterns are, and if you can find out where they're coming from, do them quickly. We have to take a break. Stay tuned. We'll be right back.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live, reminding all women to conduct monthly and annual breast exams. Also consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram, and it's safe and non-invasive. For more information, call 888-485-7736 or visit thermographycenters.com. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio today, 888-630-9625, 888-630-9625. Give us a call. Love to talk to you. Any subject you have in mind, perhaps we can put a little different spin on it without drugs, without surgery, to help you in a way that nobody's kind of exposed you to before. Well, this is your opportunity. My guest in studio, Dr. Leonard Poe, will be your host, your presenter this Wednesday evening, the 20th of March, at the Roselle Center for Healing in Fairfax, Virginia. To attend that free community presentation, all you have to do is call 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there. Did you like to attend? And guess what? You can be our guest. Once we're full, though, we're full. So even though we have a very large classroom area, it's an opportunity for you, and you need to make that reservation. I'd like to welcome our listeners out of Richmond, Virginia, 990 AM WLEE. Welcome to Dr. Tom Roselle Live. We'd like to encourage you and all of our listeners to go to drtomroselle.com, DRTOMROSELLE. Take a tour around. If you see something you like, go to our e-store and check that out. It's really a great place to learn, to educate yourself. Dr. Poe, before we get back in, we have tons of people calling in, so let's take a few of them. Dan from Stephenville, Maryland. Thank you. You're across the bridge and listening.
Yes. How you doing, Doctor?
Doing well. Thanks for the call.
Thank you. Thank you for taking it. Hey, I got a question. Since December 1, I've had pain in my ears. It started in my ears. So like this throbbing pain, and it sort of started making me feel like I'm going crazy. And pain in the back of my head. So I went to the doctors. They told me that it was a sinus infection. They put me on Augmentin, an antibiotic.
Sure they did.
I was on the Augmentin for the 14 days. It seemed to ease up a little bit, but it never completely went away. And I experienced like waves of pain and pressure in the back of my head, so bad that I feel nauseous, and it's affecting every day, as far as getting out of bed.
Okay, let me ask you a couple quick questions. Does anything relieve the pain? If you lay down, if you turn your head to one side or the other, does it mitigate it?
Well, if I lay down in bed, eventually when I fall asleep is when the pain disappears.
Okay, how about if you wake up in the morning and you're laying there? Do you feel it when you're laying there?
This morning, periodically, yes, I get waves of it.
Okay.
But it's predominantly when I get up and I starting my day.
Dan, prior to the thing starting in December, did you have any kind of injury, a car accident, a fall, shoveling snow? Did you pick up anything?
Nothing, no.
Did you have any dental work done?
No dental work, no.
Okay.
Just basic cleanings.
All right, there's a couple things that it could be. Now, right behind your ear where you're describing it, there's acupuncture meridians, there's nerve roots, there's all kinds of things. Structurally, anytime the neuromuscular system is not lined up properly, the skull on top of the spine and the muscles relative to their ability to be strong or weak, you can have a shifting of the bones, the vertebrae. In chiropractic, we call it a subluxation. Osteopaths call it a spinal lesion. But any kind of stretch of the nerve, any kind of pressure on the nerve, any kind of irritation of the local nerve exit point can cause the kind of pain that you're talking about. Set that aside. That area also has an acupuncture channel called gallbladder. It comes right up between that area that you're describing, and it can make it worse. You would see the pain get worse as night goes on. It would begin to throb even more. There's a lot of small little attachments of muscles between the spine and the skull. And so if those things become unbalanced because you overstretched an area, you were in the gym working out, that can trigger the pain pattern as well. Dietary triggers can also be part of this pattern, but what you're talking about, particularly since all the diagnostics that you've done are negative, in my opinion, without having examined you, there's usually one or two things.
The only thing that they mentioned that they had blood work done again in the past week, and they said that my liver was up 20 or 30 points. I said, well, is that something to be concerned about? Is that dangerous? And the doctor said, no, but you should be, aware of it. If you're drinking, cut off, stop the alcohol.
Yeah, that's like telling you, let's wait till you're dead and then we'll worry about it then, or you have pathology. When your liver enzymes go up, that's a flag that's telling you that there's something wrong. So if you are drinking, and I'm just going to give you my mantra, not an accusation, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, all those things are going to cause inflammatory responses within the body. If you're dehydrated, those inflammatory levels are going to be high. But the fact that your liver is high, it means that the gallbladder is going to be congested, and you can get pain in that area all by itself. I'd love to get you in the office, but you need to see somebody like us. Give us a call, Dan, or write me. Actually, go to drtomroselle.com. And I'm going to ask you some more questions and see if I can find somebody out near you that's closer to you, and I'll make that referral.
It's definitely a biochemical piece there.
I appreciate that very much.
You're welcome, Dan. Thank you for calling.
The other thing real quick, too, with that is, most sinus infections, 97% are actually viral.
That's right. Yeah, it's
so,
viral.
It still could be an infectious part of that. Just you're not treating the right kind of infection.
Yeah, viral or fungal.
Yeah.
And when you give a bacterial or antibacterial an antibiotic, it just actually makes the problem much worse. Yep. And it, particularly when you're hitting the wrong target. Let's go back to the phone. Stephen, how can we help you, sir? Thank you for calling. You're from Fairfax, Virginia.
How are you today?
Good, sir.
Thank you for taking my call. Basically, I've had 4 to 5 herniated discs for the last 4 to 5 years in my back.
Low back area?
Lower back area.
Okay.
And pain medicine doesn't seem to work, as everybody knows. So I bought an inversion table, and that basically is taking away the pain. But just recently, I got something in my leg called Play-Doh legs, I guess. You push on your lower legs, and your skin stays in.
Yeah.
It doesn't come back up.
It's called pitting edema.
And when I get up in the morning, my feet and legs hurt so bad I can hardly walk down the steps. And this has been happening, the feet, for about 6 months. I just noticed the legs in the last month.
Stephen, how old are you?
50.
You have blood pressure problems?
No.
Any cardiac problems?
No.
Okay, none that you've been told about anyway.
No, the last blood test I had was about maybe less than a year ago, and everything was fine, except for my test levels were a little low and vitamin D.
Okay. Vitamin D is critical for all of us, and you've got to get that up to, for a male, your target range should be about 65 to 70.
Right.
And you take about 10,000 units of vitamin D a day until you get it up there. You recheck your vitamin D level in about 100 days. But here's the deal. With your pitting edema that you have, it can come from a lymphatic problem where the lymph system is not draining properly. It can be a heart problem. It can be the nerves in your low back not triggering the muscle contraction in your lower legs, so it returns the fluid. See, the lymph system becomes stagnant. That's why you have all of this accumulation of fluid and so forth in the lower legs. What returns that, besides the blood, is the lymph system. The lymph doesn't have any muscle on its own, so it uses the muscles around the body to contract and push, but it also, the nerves coming from your low back control all the muscles in your legs. So you probably still have neurological impairment, even though you've decompressed the nerves by doing the flip over back swing and the decompression unit. That's great stuff. It works really well, but still you have motor function, you have sensory function, and you still may be having some very significant stenosis that's causing this from your low back. So it can be the lymph system itself. It can be a cardiac problem that you're not aware of at this point. It can be dietary, in that if the dietary patterns are such that are triggering allergy reactions with you, you're going to accumulate swelling, and you're usually going to notice it at the lowest level of your body, which is going to be your feet. So there's much that can be done about that. I have actually 5 in my low back. I got 4 in my neck, stenotic discs, degeneration, bone on bone. It's because of 2 major accidents over the last 10 years. And one was a head-on car accident that my wife and I should have been killed in. And the other one was coming off an escalator in Las Vegas. I was standing backwards, got down to the end of the escalator. I was thrown backwards, flipped over, and my head in a marble pillar mat. And so, as you can imagine, there was a lot of damage. Acupuncture, chiropractic care, nutrition, my diet is probably 85% the way it's supposed to be. I don't have the discomfort, I don't have the pain, and I don't have pitting edema, I don't have the things that you're suffering from. So what I'm trying to say to you is that things can change. What I would encourage you is we'd love to talk to you just to say hey and get a little bit more information. Attend this Wednesday's program, and we'll talk to you after the program and see if we can get a little bit more information. But I think that your problem is resolvable. We just have to figure out the why behind it. It has to be one of those things. The triggering mechanism has to be involved in that.
Okay.
Stephen, thank you for calling. I appreciate it very much.
Thank you. We'll see you Wednesday. I'll be there.
Good. 888-630-9625. That's 888-630-9625. Dr. Leonard Poe, my guest in studio, your host this Wednesday evening, the 20th of March. I'm going to talk to you about chronic pain patterns and why they don't go away. And the why generally is because you don't answer the why is that. You don't fix the underlying problem. Dr. Poe, we've got all kinds of pain patterns, so we're going to put them together one at a time. Give us a call. We still have time in the program. Bill from Herndon, Virginia. Thank you for calling. How can we help you, sir?
Hi, how are you today?
We're doing great, my friend. How about you?
I'm hanging in there. Listen, I'm a 58-year-old white male. I've got peripheral neuropathy. I've had it been being treated for it for about 9 years. Started with numbness and tingling, graduated to pinprick pain, stabbing pain. It's extended up my legs and arms, sometimes even my torso. I get these pains and all. I'm on all kinds of drugs for it. I've been tested for everything. Don't have diabetes. Don't have Lyme's disease. Had a muscle biopsy, a nerve biopsy. The muscle biopsy showed nothing. The nerve biopsy showed that I did have nerve degeneration. Looking for an alternative besides all the drugs that I take, or
there's lots of
way of diagnosing it.
Okay, let me ask you a couple quick questions. There's a lot of things that you can do for this, and unfortunately, we see more patients I want to think about in our office with the kind of presentation you're talking about.
Yeah.
I would assume, first of all, that they've ruled out diabetes, correct?
Correct.
Okay, so the next thing that we need to look at is other types of spinal problems. You look at the low back, you look at the nerve roots from lumbar 1 all the way down to lumbar 5, and you see if the disc spaces are stenotic, meaning that the canals where the nerves come out are narrowed down because of degenerative changes. That all by itself can cause the problem. If that's what it is, then things have to be changed to open up those disc spaces. You don't have to do it with surgery. conservative treatment will do it. Manual care along with acupuncture, low energy light laser, you can see dramatic changes in how the pain pattern persists.
Excuse me, I do have this in my upper body, my arms and my hands also.
Have you ever had a car accident?
Oh, I've had a bunch of accidents, sandlot football. I worked in a print shop for years, contorted all kinds of different positions. Toxic chemicals gets thrown in there too. I had, I had 2 neck vertebrae fused a couple years ago. Yeah. I had lower back problems.
That's where it's all coming from, Bill. The fact that you were in a print shop is telling me that you were exposed to all toxic chemistry, including toxic metals.
Yeah,
which is going to get in there and cause things to be worse. So you're going to look at the biochemical end of it as well. So Bill, you're probably one of those good examples where you've got a lot of different pegs, and you got to start figuring them all out. Some of it's going to definitely be structural from what you told us. Some of it's definitely going to be biochemical. The print shop thing that's huge. That'll cause the neurodegeneration all by itself. So you can't get stuck with one diagnosis. You've got to start pulling apart all the many different things that are probably going on here to start coming up with a good solution and not just covering it up over the years. And the thing of it is, Bill, that you can begin to reverse the body's damage. You can turn things around. In a perfect world, as long as you're breathing, as long as you're reproducing cells, as long as you change the chemistry, you can change anything.
That's the spirit.
But you have to be able to approach it the right way. You have to look at the chemical components, and you, as a partner in your own health, have to be willing to step up and do the things that you need to get done. But it's doable. It can be resolved. And as I said earlier, I've had significant damage to my spine. I played Division I football in college. I've had multiple accidents over the years. In the last 10 years, I got taken out because of those injuries that I talked about a few minutes ago.
Right, I heard.
But it can be turned around because I'm in good shape. I can do anything that I want to do. I can function, and I'm older than you are. So, there's hope. Give us a call, Bill, or attend the lecture on Wednesday evening and talk to Dr. Poe afterwards or talk to myself, and at least we can give you some information. We can give you data that you can consider.
Okay, great.
Appreciate your phone call, Bill. Thank you for calling.
With him and with the last patient, Stephen. Let's see, I'm already calling a patient.
There you go.
The other thing, too, that you got to look at is there's limitations to all the testing, and you have to understand some of those limitations. And when I hear this all the time from patients, my blood work was fine. Well, those are statistical ranges that you see on blood work, and they're beguiling a lot of times. They're not where they're supposed to be. You take vitamin D, for example. The range is 30 to 100. Well, 30 is far too low. 40 is far too low. 50 is still too low. Those ranges, you have to understand that those are statistical. They're not functional ranges, and you have to understand the difference.
888-630-9625. We're going to come up for a break, and then we're going to come back, and we'll still have a couple people online that we're going to get to. This Wednesday evening, if you have pain, trust me, you're going to learn more data, more information than you can possibly think of. Call our office at the Roselle Center for Healing in Fairfax, 703-698-7117. Tell my staff that you'd like to be there. I promise you're going to get more than you bargained for. Right back. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been in studio at 888-630-9625. We're here every Sunday at 12 noon bringing you the most informative, the most talked about, the most controversial information on alternative health care from a nutritional, chiropractic, acupuncture, homeopathic point of view. This is your opportunity to get information that you can't get anyplace else. But remember something. No matter what I tell you or anybody else tells you, do your own homework. Don't believe anybody, even me. Get on the computer. My job is to provoke you, is to incite you, is to get you to say, really, and then get on the computer or go to the library, do the research, ask the questions, and do as much as you can to help yourself. This Wednesday evening, Dr. Leonard Poe will be your host at the Roselle Center for Healing in Fairfax, Virginia. He's going to be talking about chronic pain patterns. He's been my guest today on the show, and this is an informative, over-the-top presentation. You're really going to learn what you can do to help yourself. All we require is a reservation, 703-698-7117. That's 703-698-7117. Let's go back to the phones. Bill from Hanover, Pennsylvania. Welcome to the show, Bill. Thank you for calling.
Thank you. Yes, I've been diagnosed with, what is it? I'm a little nervous.
Tendinitis? Relax, Bill. It's easy.
Tendinitis.
It's all good.
And at first it was swelling at the wrist, with the palm down at the outside of the wrist. And the pain goes up to my elbow and up to my shoulder. And nothing seems to be helping. Physicians, I'm on diclofenac and taking a lot of Tylenol with the pain.
Well, Bill, is the pain on the thumb side of the wrist, or is it on the pinky finger side?
Sort of on the pinky finger side, but it's more up the middle.
Okay, middle of the arm, or middle of the wrist?
It seems to go up the middle of the arm. When it's on an armrest, it seems to bother it a lot more.
Okay, it's probably you got a mix of a couple different things there.
Yeah, and first, it's not a tendonitis, Bill.
Yeah, it does sound like a tendonitis. You're getting some nerve entrapment in there somewhere, and it's a matter of figuring out which one. Either it's going to be medial nerve entrapment, ulnar nerve entrapment. It may be coming at the wrist, it may be coming at the elbow, and that's where you just got to differentially figure out, well, where is it coming from? It could be coming from the neck. You got to go through and you've got to figure that piece out. It's probably not tendonitis. There might be some inflammation in there, and that's where you also have to look at some of the biochemical components, look at things like the adrenal system. Is there a reason why it can't put out the fire? But that sounds more like a nerve entrapment than anything else.
Sounds like a compression. The fact that it's going down the middle more so than it's lateral to the thumb or the little finger says it's the median nerve, and it's coming from the 5th cervical nerve root. It can be entrapped at the elbow, it can be entrapped at the shoulder, it can be trapped at the wrist, or multiple places.
Yeah.
So it's something that can be handled, Bill. We see it all the time, particularly with our professional athletes. If we can help you, more than happy to talk to you. You can give us a message at drtomroselle.com, drtomroselle. We'll get back to you. Bill, I appreciate your phone call. Thank you for calling. Unfortunately, this show is way too quick, and we have many more of you online. Wish we could have gotten to you today. Appreciate your phone calls, but you can get a hold of us off the air as well, drtomroselle.com. This Wednesday evening, Dr. Leonard Poe will be your host, your presenter at the Roselle Center for Healing. Give us a call at 703-698-7117 and schedule. Tell us that you'll be there with us. We'll see you next week at 12 noon. Make sure you're here and available. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.